Okay, let's look at the difficulties that can occur with dementia and eating. Forgetting to eat, or that they've eaten and then forgotten, that can be difficult. Usually when you're dealing with that kind of thing, you're looking at providing just one item or one bite at a time, and every time they come back, you give them the next bite, or you give them some water, or you try to distract them with some other activities so they can move on from the eating and drinking. Reminding them that they've already eaten usually doesn't work. They're more like the Pearl or Ruby, where they'll just argue with you. So there's no point in arguing. Just have to manage around that behavior. Difficulty finding food or remembering how to cook. This is more of an issue when somebody's living in community. You may also see that when you're dealing with food service in retirement home setting. They may not remember how to cook. The staff might notice that they're not cooking as often. Trying to encourage them to come down for the meals might be something that you could do in a retirement home setting. Difficulty chewing and swallowing. The later stages of dementia often has difficulty chewing and swallowing. Forgetting how to use utensils. Again, later dementia, that's where that occurs. Eating inedible objects. A lot of times you'll see napkins often eaten. They don't realize that it's not food. Trying to make sure those items are not available if that person is doing that particular thing. Eating too much or too quickly. This is where you get a change in texture to deal with that. Lack of appetite or interest in food, or an interest in having an appetite. Leaving the dining room before the meal is done. Easily overwhelmed. That's when you're pulling them out of the dining room or you're limiting what you're giving them. Easily confused or distracted. Same idea. Minimize distractions so they don't feel overwhelmed or they don't get confused or distracted. If they're playing with the napkins, don't give them a napkin. If they're playing with their aprons, don't use the aprons. If they're playing with the if they're playing with the placemat, then get rid of it. Forgetting that they've eaten and asking more, that's what I was talking about with number 1. Food jags. A lot of times, I have a resident right now, she goes on food jags all the time. Sometimes her food jag is she will have coffee after coffee after coffee after coffee. Like she might have like 20 cups of coffee or 20 cups of cappuccinos. And right now it's ginger ale. All she'll drink is ginger ale. So it's food jags like that can happen, just like a 2-year-old, 3-year-old, toddler type food jags. Poor judgments at meals, so they don't realize that they're overfilling their mouth, or they're choosing items that they probably shouldn't because they're going to cause more trouble. So that judgment that one's really difficult to get around. Normally, that's somebody's eating too fast, for instance. What has often worked in the homes that I've worked in is if you take the plate the same as somebody who gets overwhelmed, and you only put enough for a few bites on that plate. When they finish those few bites, then you put the next few bites on the plate, and that helps to slow them down. Sometimes they get really angry. If they get really angry, you need to come up with something else, but sometimes that will work. Strategies to manage these difficulties then. Eating, it's dependent on the person and the difficulty that they're having and what stage of dementia that it occurs. In the Canadian Alzheimer's Association Mealtimes, again, an older resource but very helpful. They do have a newer version of this found at alzheimers.ca. We'll go to that in just a minute. So using this resource in the next activity, match the case study mealtime difficulties to the strategies in the Alzheimer's Society Mealtime Strategies for Managing Mealtime Difficulties. This is the newer version of the mealtime help. So we can roll down here and it goes through decreased judgment, concentration, poor visual, motor abilities, goes into dehydration, constipation, decreased appetite. So there are different tips for eating out, overeating. So these are all things that can do. Like we said, I've listed these already in the slide deck. So let's go down. And what I want you to do is actually look at some of these items and apply it to the case study that is on the slide deck or in the activity. And there's some different ones here. So you can use this resource, or you can use this resource, which is older. It was done in 2018, but I find it's even better. It's the same similar information that's on the new one, but the way they have different things set up for the different items it's set up differently, so you might find some useful tools that way. So you can use either or of those resources to complete the activity. So the first case is Amanda. She's 60 with Alzheimer's, living with her life partner and community. Amanda is starting to have difficulty remembering to eat, often skipping meals. She has left the stove on several times. Her family and life partner are worried Amanda's safety preparing meals and are wondering what they can do to help her. So name the difficulty Amanda is having that's affecting the meals. Might be more than one. And which mealtime strategy could Amanda's family apply? And you can use either one of those resources. Next case study is now Amanda's moved into long-term care. You notice she's having trouble using utensils, eating and drinking on her own. She is not using the utensils appropriately, and she's ignoring her beverages. What strategies can you use to encourage independence at the meals and encourage fluid intake? And again, I just put the link in again in case you needed it. Okay, Amanda has now moved into the long-term care. She's been there for a few months after the admission, and she's asking for food even though she's eaten. So she's forgetting that she's already eating, and we're looking for strategies that staff can use to help Amanda avoid overeating. Topic is the MIND diet.